We seem to have a good audience here. We have great panelists. Looking forward to speaking to you all. I think we can actually go ahead and get started. We got a pretty decent amount of folks at 67 here right now. So I just want to say thank you for joining us today on our inaugural LED webinar session. This webinar series is brought to you by the Richmond City Health District and the Virginia Poverty Law Center through a grant from the National Center for Healthy Housing. The purpose of these webinars is to expand awareness of the dangers of lead hazard in homes across the Commonwealth, and to really build a coalition of support to develop local and state ordinances to require a lead inspection in rental units, which doesn't quite exist yet. And today we have an amazing group of panelists who are working on the front lines. Dr. Danny Avula, Director of the Richmond City Health and Henrico County Health Districts. Dr. Jenny Ross, pediatrician and toxicologist with the Blue Ridge Poison Center. Hope Cuppet, President and CEO of the Southeast Rural Community Assistance Project. And Queen Zakia Shabazz, multi-talented author, educator, lecturer, and environmental justice advocate, and the founder of the United Parents Against Lead. So please feel free to utilize the chat function. We have a Q&A feature as well that you can enter your questions in, and we can answer those during the Q&A session, or panelists can answer them directly through a text. So after following all our four presentations, there'll be a chance to answer all your questions. Some of those questions that we don't get to, we'll try to answer them offline for you and provide them on the site. And please remember, this is the first of 4 webinar sessions. Next week, we will be talking about how lead hazard is assessed and removed, but also talk about the challenges of the process. After this, we will have 2 more sessions where we will talk about the legal landscape of lead hazard control. And then the final week, we'll talk about national best practices and kind of bring it all together with a call to action. So please remember to register for each session. And with that, I'm gonna turn it over to Dr. Avula.
Thanks, Eric. And hi, everyone, whoever you are out there. I don't know if you overheard our earlier conversation about who this audience is, but I hope that whoever you are, this somehow strikes a chord or at least sets the context for the conversation today around the connection between health and housing. So the title of this brief intro is that health is housing and housing is health. And my hope is that I'm able to kind of provide context and examples of how deeply intertwined health and housing are, and why in our work in public health, we have over the last few years emerged bodies of work where we look more deeply at that connection. I also want to thank everybody for giving me an excuse to think about something besides COVID, because that is really all we have been doing at the health department for the last, I don't know, 5 months now. Yeah, I'm going to try to work with this delay here. And so, you know, as I was talking about this connection between housing and health, COVID has even, in the way that we have responded to our, you know, the new cases that showed up, trying to figure out how to contain disease, ensuring that the disease is spreading, we're seeing that connection between health and housing. So much of earlier on in the pandemic, where we were seeing spiking cases in our Latinx communities, we recognized that one of the challenges to try to contain disease was that we had many people that were part of a family or part of multiple families living in very close quarters. When I had 12 people living in a 2-bedroom apartment, largely due to concerns around housing affordability. And that concern around housing affordability had implications for people's ability to actually and quarantine effectively. And so this is just one of many examples of where housing and health really do intersect. And I would say the field of public health across the board has definitely helped us to see this. And this framework that was developed by the University of Wisconsin and the Robert Wood Johnson Foundation at what are the drivers of health at the population level, because our job in public health is to understand what makes communities or populations healthy, and so often we think about healthcare, the ability or opportunity for somebody to have access to a doctor as one of those things, but also recognize that there are a lot of other drivers of health. So for example, the health behaviors in the community, what you eat and drink, how much you exercise, what kind of risky sexual behavior you may engage in, but then also the physical environment and the socioeconomic factors on the left side of that pie right there. The built environment, the physical structure that you live in, the environmental quality, air quality, soil quality, water quality, and then the socioeconomic factors like the education level of a family. Do you have stable employment or not? And do you have stable housing? And I think this evolution of our understanding of what drives health outcomes has led to kind of the bridging of the health and housing world. And one of the movements in the housing world that finds itself to be incredibly true in the public health world is this idea of housing first, that without stable, affordable, safe housing, so many of the other aspects that contribute to the health of the individual or a family or a community really are afterthoughts. Because when you are worrying about keeping a roof over your head or keeping a job so that you can pay rent, you are not able to worry about many other things that contribute to the health of you and your family. And so we have really started to espouse this housing first thinking in our work in public health. I also found this framework that the Pew Charitable Trust put out several years ago has been really helpful in thinking about the different ways that housing can impact health, because that's certainly true for the individual and kind of the built structure around them or the substandardness of that housing. But it's also true when you start to think about things like, is your housing affordable, or are you having to really stretch your budget to keep that roof over your head? Or what's your housing community look like? And so what I want to do over the next 10 minutes is just map out from big picture to more from macro to micro, what that link between housing and health looks like. So I want to start in this upper right corner, the housing community, and maybe the whole right side, housing community and housing location, because we recognize that neighborhoods where you have deep degrees of racial segregation and concentrated poverty, those often create poorer health outcomes or poorer health conditions. And so we've got to be thoughtful about how we design those communities or what the amenities in that community might look like, and how that contributes to health. I'm going to switch, because of this lag, I'm going to switch over to, let me just.
Did we lose you, Danny?
It looks frozen.
Yes. Get him back. There you go.
Lose me? Am I back?
You're back. Here we go.
Sorry about that. I'm still in view mode for you, Eric, if you want to switch back to me, or if you want to just advance the slide.
Yeah, let's do that. Maybe it'll be a little faster there.
Great. Okay. So as we're talking about the idea of community and concentration of poverty and its connection to health, I just want to take a couple minutes to think through the impact. Many of the folks on this call have likely heard of the concept of redlining, a practice that banks and our federal government engaged in back in the earlier 1900s, kind of 1940s and 50s, where certain communities were redlined. They were marked as communities that banks should not lend money to, and which obviously created concerns because you wouldn't have high rates of home ownership in those communities. And the real underlying problem with redlining is that so much of the determination of what communities were redlined, what communities were not invested in, was who lived there and what the community looked like. And that was very racially driven. And so here's a map of early Richmond in the 1950s. And you see from the Homeowners Loan Corporation, the entity that actually made these designations, what neighborhoods were given an A grade, a B grade, a C grade, or a D grade. And again, a lot of the definition or the criteria of how those grades were given were given through who lived there, what was the racial makeup or the income makeup of the residents of that community. And so what I want to do is just show you back in the 1950s, when these communities in Richmond were given D grades, you'll see these two red circles here. And I want you to just follow those two parts of the city. So the first red circle is the cluster of public housing communities in the east end of Richmond. And then the second circle below there is Hillside Court and parts of the Jeff Davis corridor, for those of you who know Richmond, another historically low income and predominantly minority part of our city. Next slide, Eric. So here is a map of low birth weight in our city, and this is 70 years later, 70 years after redlining occurred. But because of the impact of not making ongoing financial investments of the community, by building public housing and other government subsidized housing communities, by maintaining a certain level of racial segregation and concentration of poverty, what we see 70 and 80 years later is that we still have hotspots of poor health outcomes in those same communities. So this is low birth weight. Next slide. Here's a map of hotspots of gonorrhea incidents, one of the sexually transmitted diseases we follow, and you see the same hotspots in those same communities. Next slide, Eric. And here's life expectancy. So the projected number of years that you may live in is lowest in those same degraded communities. And the point I just want to quickly make here is that the policy decisions and the subsequent disinvestment in those communities, the concentration of poverty, the lack of investing in amenities, in green space, in schools, in those same communities, have implications for the health outcomes of those communities. Next slide. All right, so back to housing community and housing location. Hopefully that link has been made to you. Now I want to talk a little bit about housing affordability. In that bottom left, we see that affordable housing enables people to pay for other things, right? So if you're spending 50 or 60 or 70% of your income on housing, that means you have less expendable income to pay for nutritious foods or for medical care when you need it. And that also has impacts on your health outcomes. And then you think about things like behavioral health, like substance abuse addiction, or mental health, depression and anxiety. And those are just such afterthoughts when you're really just trying to maintain stable housing. Next slide. So here's a study that was done. The Richmond Memorial Health Foundation, which is a local health conversion foundation here in our region, did something called a market value analysis in conjunction with one of the largest CDFIs, community development financial institutions in the country, reinvestment fund based up in Philadelphia. And this is a couple of years ago, but the next slide, Eric, will show you that what we did was we looked at housing affordability across the region. And so we mapped the areas that are affordable at up to 80% of AMI, that area median income. And as you look at this map that extends beyond the city of Richmond, into parts of Henrico and Chesterfield, you see all of those areas that are shaded brown are not affordable at 80% of AMI, that there are very few parts of our region that really do meet that metric. And so you think about if people aren't able to afford housing and are having to spend a huge proportion of their income on shelter, what the trickle down is when they don't have money to spend on food, on exercise, on healthcare, and on behavioral health. Next slide. So our region has really undertaken a really important body of work in developing this regional housing framework, really trying to drive priorities for affordable housing. Housing Virginia has been a huge part of that work, and other partners throughout our region. The Partnership of Housing Affordability is who houses that. But I think this is one of the really important things that every community needs to be looking at, is what is the availability of affordable housing in every community, because it is such a driver of health. Next slide. All right, and so now we'll kind of drill down to the micro, where we think about the actual structure that you live in that upper left, housing quality. So we know that housing that is safe, dry, clean, maintained, and adequately ventilated has really beneficial effects. Richmond is a particularly bad place for some of this, both because we have communities where we have a lot of substandard housing, but we also have an interesting and challenging environmental milieu that impacts health outcomes. Next slide. So across the country, we know that over 6 million homes have infrastructural problems that lead to water intrusion, ventilation issues, pest infestations. And why is this important? Next slide. When you have intrusions of water or pests, you have issues with breathing, respiratory conditions, asthma, allergies, and that is, as I said, particularly true in Richmond. So the Asthma and Allergy Foundation of America does something called Asthma Capitals every year. They haven't yet done 2020s. This slide is obviously a couple of years old, but it ranks based on an index of a bunch of different things related to asthma. What are the worst places in the country? Richmond perennially is in the top 10 on this list. Just 2 years ago in 2018, next slide, we were number 2 overall. And you'll see in the red circle on this next slide that Richmond was actually the top in the nation for the number of asthma fatalities. And so it is, again, this environmental context, the fact that we have really high environmental allergens, we have relatively high poverty rates and therefore lower access to healthcare and effective management of asthma. We have a lot of substandard housing, which leads to the driving of asthma exacerbations because of moisture leading to mold or pest infestations. Cockroach feces are one of the major triggers of asthma. And so because of all of those reasons, Richmond really finds itself in a tough spot for asthma and allergic disease. We've dropped out of the top 10 in the 2019 rankings. We'll see if that is a sustained trend or just a blip, but we hope that we continue to make progress in this area. Next slide. And that brings us to kind of the reason that we're all here today, to really talk about lead poisoning as one of those drivers of poor health outcomes in the built environment, in the housing structure. The Richmond City Health District for years has been really invested in surveillance, actually looking at data, monitoring lead levels in our community, and then being able to respond when we identify a lead poisoned child by going in and doing environmental assessment and holistic case management of that child and their family to ensure that we can remove the lead hazard, avoid the lead hazard, and assure a great outcome for that child. Many of you know Donna Huang, who leads our Healthy Homes and Lead team, and all of the amazing folks that we have on our lead team who have just learned both the technical side of this work and the importance of the relational side of this work as we are invited into people's homes and walk alongside them in what can be a really anxiety-producing scenario. And you'll hear more about that in today's webinar, but we'll go to the next slide, and I will just make this final point that housing and health are incredibly interconnected, and and us approaching housing and health together, like these are the real building blocks of equity and opportunity in our community. And that has to be the lens with which we lead. So thank you. And I will hand off to my colleague, Dr. Ross, to do a deeper dive on lead.
Thank you, Danny.
All right, thank you so much. My name is Jennifer Ross, and I'm honored to be here and talk about my experiences with lead toxicity or plumbism. This slide explains a little bit about my background and how I became involved with lead toxicity, but to summarize, I'm a pediatric toxicologist at the University of Virginia, and through my work with the Blue Ridge Poison Center, I work frequently with lead toxicity kind of from a clinical standpoint. So during my part, I'll be talking about the history of lead toxicity and sources of lead, followed by a discussion on clinical outcomes associated with these elevated blood lead levels at the individual level. And then I'll wrap up by talking about the basics of treatment for lead toxicity and how often we're doing lead screening throughout Virginia. So just to go back in history, start from the beginning, lead toxicity has been recognized as far back as the 2nd century BC. There was an ancient Greek physician, Dioscorides, who wrote a book on herbal medicine and pharmacy and stated lead makes the mind give way. During Roman times, lead was used frequently for items such as pipes and cooking utensils and ceramic glazes. They recognized that fumes from lead smelting were dangerous, but they continued to use sapa, which was a grape syrup kind of used as a sweetener and made in lead vessels. And some modern authors have actually posed that excessive use of sapa by these aristocrats might have led to the downfall of the Roman Empire. In American colonial times, aristocrats, similar to these aristocrats, Benjamin Franklin noted that tinkers and painters and people using lead developed abdominal pain and wrist drop, joint pain due to lead poisoning, and that the rum they were making and lead condensing coils caused abdominal pain. And then in the 19th century, they used lead salts medicinally, and due to the Industrial Revolution, lead poisoning became a common occupational disease. Andrew Jackson, the 7th president of the United States, reportedly had significant exposures to lead. He was frequently treated with this lead acetate, and he also had 2 lead bullets that remained in his body until his death. So this article is actually the first mention of lead toxicity in print that was published in the Lancet in 1874. And it's talking about the hazards of working in lead factories and the idea that lead is this toxin that you can accumulate and become sick from. Lead toxicity specifically affecting children was first recognized in Australia in 1897, and it led to a ban on lead paint in Australia in 1914. Lead poisoning in American children was recognized in 1917, and by 1943, it was established that children who recovered from lead poisoning were frequently left with these neurologic deficits and intellectual issues. Symptomatic childhood lead poisoning was a pretty frequent occurrence in the 1950s and 1960s in American pediatric medical centers. And since that time, the CDC has decreased their definition of an elevated blood lead level in children from 60 back in the 1960s down to 5 in present day. So sources of lead exposure are going to be discussed also in more detail by our next speakers, but for a quick overview, there are numerous sources both in the environment and in man-made objects. Air can be contaminated with lead due to industrial emissions, and while the ban of leaded gasoline use in America in 1976 significantly decreased air pollution from lead, gasoline containing lead is still prevalent worldwide. Adults with occupational exposures might absorb lead through inhalation of dust and fumes, breathing in those gases, and they can bring lead contaminated clothing home to kids. Lead was used in many paints until it was banned for household use in 1978, but there are still homes that were built prior to then that have flaking or peeling paint, which is the most common source of lead poisoning in children. Some homes also contain lead dust, which forms as the paint kind of ages and deteriorates, and then it settles on the floor and other surfaces in the house. It can also form if you're routinely rubbing or scraping these surfaces, as in old renovation projects, or lead paint can be found on old playground equipment or on toys that are imported. You can't tell just from looking at paint if there's lead in it. And children, ages about 1 to 3 are pretty susceptible to this exposure, since they spend considerable time crawling on these surfaces and touching their mouth with their hands. And they also sometimes have been known to eat these chips of flaking paint. The Consumer Product Safety Commission determined that a daily ingestion of as little as 1/10 of a square inch of paint, so that's about the size of a pencil eraser on the top of a pencil, over the course of a couple weeks to a month could result in a lead level of 10, which we'll talk in a minute about what those levels mean. There are also numerous other sources of lead, contaminated folk medications, imported food and cosmetics, and elevated lead levels in drinking water, which is from the pipes and plumbing, and such as occurred in Flint, Michigan in 2014. This is just a quick slide on how lead gets into your body. The 2 ways that lead exposures mainly occur from ingestion or eating the lead, or inhalation, which is breathing in the lead. With eating, adults only absorb an estimated 10 to 15% of any lead in the food, while children absorb higher amounts, around 50%. And if a child hasn't eaten in a while, or they're not getting proper nutrition, that can actually cause even more lead to be absorbed in their body. The picture seen in the top right corner is actually a child that we treated who had been eating paint chips. If you look kind of towards the bottom of the x-ray, you can see the little white flecks. Those are actually pieces of lead paint in their stomach and gastrosystem. In this setting of breathing in lead, around 30 to 40% is absorbed. But if you breathe faster, you tend to inhale more lead, and children who on average breathe faster are proportionally at higher risk because of that. Lead also readily crosses the placenta during gestation, starting around the 12th week of pregnancy, meaning that if mom has lead toxicity, she can pass it on to her baby. And breast milk can also contain lead as well. So, kind of transitioning to the more clinical outcomes of lead toxicity. In 1979, the children who had elevated blood lead levels used by measuring the lead in their baby teeth were kind of tested, their intelligence and behavior testing. And it was determined that these children with lead exposures were more likely to have neuropsychological deficits that ended up affecting their behavior in school settings. Since then, there's been numerous clinical symptoms associated with lead toxicity. It has significant effects on the developing brain and can lead to changes in its function. Long-term exposures can affect your learning and your memory, and in severe exposures, there can be swelling of the brain, which is life-threatening and causing headaches and lethargy and seizures and coma. Vision and hearing can be impaired, leading to speech problems, and there have also been reports of taste being affected as well. Lead can cause toxic effects on the blood, leading to anemia and causing children to become pale. And with significant and chronic long-term exposures, the lead gets deposited in the bones, which can stop new bone from forming, leading to impaired growth and short stature. It also causes muscle weakness, pain in the muscles and joints, and a peripheral neuropathy, so nervous problems of your hands and feet, which kind of creates this wrist drop picture as seen in the top right corner. That is a house painter with long-term exposure to lead paint, which results in this muscle wasting of your hands and a kind of downward going wrist. It also causes constipation, loss of appetite, abdominal pain. There's an association between lead and gout that was discovered more than 100 years ago. And it can cause hypertension or high blood pressure and cardiovascular issues or heart disease. And impairment of both male and female reproduction has been associated with lead. This slide just gives a list of the different blood lead levels and the symptoms that are associated with each level. This is obtained from this chart on the right, which is from the CDC. and it was made prior to 2012, which is when they decreased the level of concern from 10 to 5. But you can see that even low levels of lead in the blood are associated with growth issues and IQ deficits. And the other symptoms such as anemia and kidney problems and brain issues develop as levels increase until finally, without treatment, you have death. Providing intensive care for these kids can prevent death, but even after that, there can be severe brain damage despite treatment. And you can't rely on symptoms occurring to know what level of lead exposure they've had. So you have to test if there's a concern. I won't go into this much, but as mentioned on the other slide, there are treatments available, but the best treatment, of course, is prevention. And so that means removing these sources of lead so that the lead exposure never occurs and the toxicity can't develop. We can give treatments. They're chelation, basically meaning medicines that bind the lead in the body, but they are very, long-term treatments. They take days to weeks, medicines happening as often as every 4 hours. You have to keep checking lead levels to see if the kids are responding, and it's not a cheap or easy process for either the kids or their families. So really preventing this from ever happening is key. This slide just goes over who's getting screened for lead. These recommendations are from Lead Safe Virginia. So all children in Medicaid get screened at 1 and 2 years old, but there's also other, screening measures, living in an old house or being exposed to a parent who is exposed to lead that also trigger this to do more frequent screening in these kids. And then finally, we'll talk about guidelines from the CDC that, just review recommended actions based on blood lead levels. But again, it's hard to, know what to do based on these numbers themselves. And if we can prevent this from ever happening in the first place, that's going to be the best way to do it. The Poison Center is involved in all these cases, and we can help guide management on an individual case-by-case basis. But as prevention is key, I think that will segue nicely into our next speakers who can talk about, their experiences.
Awesome. Thank you, Jenny. And next up, we're going to have Hope.
Good afternoon. Can you hear me okay?
Can hear you great.
All right. And I can control my slides, Eric?
Yes, you can.
All righty. Good afternoon, everyone. And I'm so happy to be here. And thank you so much for the first two presenters. We're learning a lot about lead. I'm here from SIRCAP. My name is Hope Cupid, and just want to give you a quick history. Is it moving?
There we go.
Okay. Okay. I think it may be a delay. Let's tell you a little bit about SIRCAP. SIRCAP, our official name is Southeast Rural Community Assistance Project. We like to go by SIRCAP. We're a 501c nonprofit, and we're located in Roanoke, Virginia. Our primary focus is to improve the quality of life for people living in rural communities across the Southeast United States. And since 1969, we've always advocated to ensure that every single person living in our service area has daily access to clean and affordable drinking water, working indoor plumbing and water facilities, along with safe and affordable housing. And you heard the issue about affordable housing. That is an issue, and we hope that our country can resolve that. Our advocacy and technical expert worked on data over the past 50 years of our work in our service area. And what we found was that our work led to people staying in school and out of jail, has prevented hepatitis, meningitis, and certain cancers. And also it has created and supported sustained economic activity in the rural communities that we serve. Let me see. Okay, there we go. So what is lead? We just had a really good discussion by Dr. Ross about lead. So I'm just going to give a little overview because she did a great job. Lead is a dense, relatively soft metal. It has low tensile strength. It's easy to smelt, and as we heard before, it is widely available. We do a lot of work with EPA on the lead and copper rule, And the lead and copper rule was established in 1991 to protect us from such hazards as lead and copper in our drinking water. And unfortunately, although that was installed in 1991, we still had incidents like Flint, Michigan, and Denmark, South Carolina, still happen to the most vulnerable populations among us. And I think Dr. Danny explained that and explained to us why that happens. So that's something that we need to work on. What is an action level? We know that since 1991, lead in water has been reduced by 90%. We also know that from the EPA's recent study for state drinking water, that 97% of the systems in the United States have not reported any action levels within the last 3 years. So what is an action level? And that's the lead action is a measure of the effectiveness of the corrosion control in our water systems. The action level is not standard for established or safe lead in a home. To check if corrosion control is working, the EPA does recommend that you have testing of lead at the tap in certain homes, including those with lead service lines. And we in Virginia still have about, from the last I've heard, about 97,000 lead service lines in place. We have tested samples from the smallest of 15 parts per billion. And if 90% of those have water concentrations of lead that are greater than that, then the water system must perform certain public education, also in addition to using corrosion control in those lead service line replacements. And corrosion, what that is a dissolving or wearing away of metal caused by a chemical reaction between water and the plumbing. There are a number of factors that make that happen. For instance, the chemistry of the water, whether it's very acid or alkaline, and the types and amounts of minerals in the water. The amount of lead it comes into contact with, the temperature of the water, the amount of wear in the pipes and fixtures, and how long the water stays in the pipes. Now let's just stop there for a second. During COVID-19, there have been a lot of buildings, especially school buildings, that have been sitting still and the water's just sitting there. So if schools do open, it's very important that the water is flushed to get rid of any potential lead in the pipes. Also, another instance is the presence of protective scales or coatings inside of the plumbing material. That also impacts what's going on with the presence of lead. Okay. Possible health effects caused by high lead levels. So how does lead get into your drinking water? It is not naturally occurring in water, so how does it get there? It can enter drinking water when plumbing materials that contain lead corrode, especially where the water has high acid or low mineral content that corrodes pipes and fixtures. The most common source of lead in drinking water are lead pipes, faucets, and fixtures. In homes with lead pipes that connect the homes to the water main, also known as the lead service lines, these pipes are typically the most significant source of lead in the water. Lead pipes are more likely to be found in older cities and older homes before 1978. I thought it was very interesting in the last presentation, we heard about Rome. That's an old city and the presence of lead there and what may have happened to Rome back then because of the potential of lead. And also lead could be seen in homes before 1986 that don't have lead service lines, but have chrome fixtures or brass faucets with lead solder in it that will also mix and get in the water. Lead is a cumulative toxin with no immunity. Repeated exposure causes a lot of harm to the body and allows it to accumulate in the body. The damage that it causes physiologically affects the central and peripheral nervous systems. You also see instances in your gastrointestinal tract, your kidneys, and your blood system. And I think the slides that were previously presented go in much detail for that. And I want to also have access to that if I can. What do we mean by plumber solvency? The ability of a solvent, notably water, to dissolve lead. Is more common in older pipes, The water attacks the lead pipes and lead solder. Some private plumbing systems still contain lead piping, especially the lead pipe service lines from the road to the house. And besides lead service line replacement and replacement of plumbing, what else can homeowners do to reduce lead if present in their drinking water? So first, use only cold water for consumption, especially if you're mixing baby formula. Hot water from your water heater is likely to contain higher levels of lead, so please don't do that. Second, since water length of contact with lead containing pipes and fixtures is one of the greatest causes of lead in drinking water, flush your water at the tap. This is the most effective way in removing lead. So how long should you flush? If water at a particular tap has not been used for 6 hours or longer, flush the cold water by running it until it gets as cold as it will get. If there are or has been heavy use of water elsewhere in the house, like someone has just taken a shower or flushed the toilet, it may take only 10 to 30 seconds. However, if no water has been used, allow yourself about 2 minutes to run the water. So using a water filter is very essential. How does a homeowner test for the presence of lead in your drinking water? There are a number of do-it-yourself test kits available. And SERCAP has been meeting with Virginia Tech's Department of Civil and Engineering Department on lead test kits. The department has lab tested at-home test kits for lead in drinking water to verify their accuracy. Another way to help protect yourself is eating clean food and drinking pure water is vital to being healthy in our society. How do you know that the water in your house is clean and safe? Drinking of unfiltered water can affect your health. So it's important to make sure the water is clean before you drink it. Sometimes people think boiling water can remove all the impurities in the water, but it can often make it worse. So eliminating all possible contaminants from your water, you may be able to use a water filter to help you with that. And sometimes the contaminants in the water usually affect the smell and taste of the water. And if I may, just for an aside, I think Virginia has the best water in America. I am in Florida right now, and this water is awful. It smells, and we're buying bottled water here. Okay. I think, let me see right there. Filters. Well, when we have been working with Virginia Tech, and it is recommended that you purchase a point of use faucet or picture filter, and the filters need to be certified by either the Water Quality Association. And if you need to make sure that when you do purchase one that you see WQA or NSF on the filter and that it does certify that it removes lead. Not all filters have been tested, and if you get the cheaper ones, sometimes those are not tested at all. So we recommend, and I do have a list, if Eric wants it, I can provide it to him from Virginia Tech of the lead pipes, of the lead filters that they have tested. So that are doing or at home testing rather, and they cost anywhere between 10 to 40 bucks. I think that would be a good resource if you want to get those filters and learn about that. We do not recommend that you purchase any water filters from Amazon. We do only recommend purchasing them from Walmart, Target, or Home Depot, or any grocery stores or anything like that. So I want to take a look at Virginia. Let us just sit back and we'll give you an example of a community that we have worked with. So during 2019 and the first half of 2020, 33 of the 1,116 community water systems and 24 of 516 non-transient, non-community water systems have experienced a lead action level exceeding 15 parts per billion. This is in Virginia. What is a community water system? Basically, a community water system is one that has at least 15 service connections, is used year-round, and the residents are usually there regularly, and we serve about 25 residents year-round. Now, a non-transient, non-community water system is one that regularly serves at least 25 of the same persons over 6 months. So let's think about a daycare center or a school. And that just gives you an idea of what areas and have been impacted by lead in our state. And besides replacing the lead service lines, what can the public water systems do to help reduce that? All they have to do is add corrosion control to the water to help treat it. This provides a safe protective coating that is formed on the interior pipes and inside household plumbing fixtures, and it keeps the water from coming into contact with the lead in the pipes. The chemical is safe and it does not cost a lot of money. It's a minor capital cost, and the cost of the chemicals themselves is very modest. So let us provide you an example of how effective corrosion control is at reducing lead in drinking water. One Southwest Virginia water system that we have worked with on other projects recently experienced very high levels of lead in a number of homes, especially in the older section of town. The lead action level exceedance back in 2018 had reached the point where the town had to normally only collect 20 samples annually. Now they have to start collecting 40 samples every 6 months. And the town instituted a public education program and worked with the treatment plant to better control contributing water quality characteristics like the pH and the alkalinity, and it still didn't work. The 90th percentile result for samples collected in the first half of 2019 was 41 parts per billion, and the highest sample collected from one house was 351 parts per billion. And the Virginia Department of Health required at that time that the treatment plant supply the town's drinking water to begin adding corrosion control back in June of 2019. By the time the second set of 2019 samples were collected, which was in October of 2019, the 90th percentile resulted had dropped to a 5 parts per billion, and only one sample was higher than the 15 parts per billion. And that was the same home that had the 351 parts per billion of lead, which had dropped to 29 parts per billion. That's still not good, but at least it had dropped. So at that point, since that one home was still having problems, that one home had to purchase a faucet or a pitcher point of use filter at the tap to prevent the lead levels to go down, to prevent the consumption and from harming the folks in the home. Okay. So how can SIRCAP help, and what are we doing to help? And we are helping. This situation was so important to me that SIRCAP received, we applied for and received a grant from Springport Partners to help us deal with lead in drinking water, especially in our region. So we started a lead service line replacement program, and we can provide up to $5,000 to remove lead pipes from inside the home. All we're asking is that the PSA apply for the funding through the Virginia Department of Health to help remove the lead service lines from the street to the house, and we will help the homeowner remove the lead pipes inside the home. So homeowners must be income eligible, and if we cannot fund with grant funds, we will provide you a loan to help remove the pipes from your home. Again, if I'm not mistaken, I do believe that the Virginia Department of Health still has that program. I know they've done some of this in the Richmond area. We want our rural communities to apply so that we can help you all remove the lead service lines in your area. SIRCAP will also provide filters for homeowners if there is a concern about lead in the water once you get it tested. All that we want is to make sure that we have a cluster of 6 homes in a community. So that is all for my presentation, but because I gave you all a quick overview, we have a test, right, Eric?
Yes, Flora, I think you can queue up these poll questions for me. Yep, there you go.
So, and they can just go start to take the test?
Yep.
Okay, okay. Well, we have 82 people on here. Come on, guys, let's answer these questions.
And I'll just
You have to.
call these questions here. What is the most common source of lead in drinking water? That's the first question. The second question here is how many lead service lines are still in use in the United States? I believe Flora, and we'll
Can
hopefully
you launch the poll?
For those that are on the phone, you might want to also read the answers if we have time.
Sure, yeah. The choices for the first question are rainwater, deposits in the river, lead pipes, faucets, and fixtures, chemicals used in drinking water. And that question was, what is the most common source of lead in drinking water? The second question is, how many lead service lines are still in use in the US? Your options here are 10 million, 6 million, none, or 2 million. And just give it a few more seconds. And I guess, Flora, if you could close the poll. Oh, is there another question? Yep.
We still have people. Taking the quiz.
Okay.
We have 37 out of 75 people quickly going up. So give people a few minutes to figure this out. And once it slows down, I can stop the poll.
Was there a third question?
Yeah, it's how can you reduce you and your family's exposure to lead? And the options are boil water to remove lead, buy high lead faucets, use a lead filter, or use hot fresh water when cooking.
Awesome, thank you.
All right, it looks like we have leveled off at 42 responses, so I'm just going to close the poll.
Okay.
All right. And what was the third one? If you can show me that, Flora.
I just shared the results. Y'all should be able to look at the results.
I can't see the
You
third
can
one.
scroll down. You can scroll down.
I have to do it. All right, everyone did very well. All of those answers are correct.
So the most common source is lead pipes, faucets, and fixtures. And there's still 6 million lead service lines still in use. And I cannot see the third question.
It says use a lead filter.
Okay.
How can you reduce you and your family's exposure to lead? Use a lead fixture. And if they want the list from Virginia Tech, I'll be glad to email it to you.
Yeah, if you want to send that to me, we can do that with their slides.
Thank you. Thank you, guys.
Thank you. And next up, last but not least, we have Queen. I'll give you control.
Okay. Thank you, Eric.
Thank you.
And for all of the panelists that have gone on, thanks for sharing all the information. So lead safe homes, healthy families, and I've added toxic politics to address the continuous lack of political will to eradicate lead poisoning. So in 2014, United Parents Against Lead coined the term childrenism. 2014 was when the city of Petersburg had a $1.2 million HUD lead grant rescinded for failure to implement. The funds were to be used to create lead-safe and healthy homes. So we define childrenism as the systematic discrimination against children, gross negligence, gross dereliction of one's responsibility to children, and practical opposition to the safety and wellness of children with willful disregard and failure to protect children in one's charge. So my arrows are not working, Eric.
Can you try clicking screen and then,
Let me see.
there you go. Can
Try.
you try your arrow now? There you go.
Okay, thank you. So when UPAL was founded back in 1996 as a result of my son being poisoned by lead, our major focus as parents of lead-poisoned children was to increase awareness and to be a support network for those of us raising, caring for, loving, and living with lead-poisoned children. Dr. Frances Cress Welsing, in her book, The ISIS Paper, The Keys to the Colors, published in 1992, talked about the very real genocide of people of color. Using Dr. Cress Welsing's definition of people activity, UPAL did a comparative study of the effects of lead on people activity, and as an organization, we decided to concentrate primarily on ensuring that the medical, education, and housing needs of lead-poisoned children are known and met. And that brings us to the topic of environmental justice. What is environmental justice? Environmental justice is defined as the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. So in the year 2020, it is criminal that children are still being poisoned by lead in their homes, whether from lead-based paint, lead in water, lead in toys, or lead brought into the home from work or hobbies. Environmental justice is synonymous with environmental racism, and the systems that are in place allow for the existing laws, regulations, and policies to have a blind eye or look the other way when it comes to affordable housing and children being poisoned. An example would be the historical use of redlining, as Dr. Danny mentioned. Redlining, which designated certain neighborhoods and services for certain people and excluded others based solely on race. Although redlining was banned some 50 years ago, many communities are still suffering the effects of redlining, and too many children are still living in toxic dwellings, and their homes are literally making them sick. And EJ not only refers to the natural, the air, the water, and the land, but must also include the cultural, the ethnic identity of people and the history of the community, the social, existing or lacking public services such as health, access to health, and access to equal education, the economic, the individual or collective wealth, access to employment, entrepreneurship, and local businesses in the community, and of course the political. So EJ must include the cultural, social, economic, and political components of a community. That is Dr. Frances Cress Welsing. She is one of my sheroes. And she said that children are the only future of any people. Children are the only future of any people. If we believe that, then what are we each individually and collectively prepared to do to ensure our future? Lead poisoning is the #1 environmental threat to young children. This statement was true before my son was poisoned, was true in 1996, and is true now. Let us be clear that when we say Blacks are disproportionately impacted by COVID, we should be saying, or actually saying, that Black, brown, and indigenous people have always been disproportionately impacted by whatever societal ills are present, and be clear that it has been and is by design. We can eradicate lead poisoning if we really want to. So again, what are we prepared to do to ensure our future? This is a photo attached to the Toxic Politics, Lead Poisoning in Richmond and Beyond class, where I served as a guest lecturer a few semesters ago at the University of Richmond. Dr. Andrea Simpson was gracious enough to allow me to introduce UPAL and environmental justice to her students. We have to tell the truth even at the expense of offending others. I'm not so much concerned with the truth hurting someone's feelings as I am with the hurting of children when I see photos like this one in the faces of the thousands of children I've seen through my work with UPAL, and think of the burden they feel as a result of the heavy metal poisoning, the pain that they are in, and the permanent brain damage. This is the house that poisoned my son Zaki. It is in a red line district, that one of those districts that Dr. Vula spoke of, right down the street from Hillside Court in Richmond and the Jefferson Davis corridor. The house still stands today, no doubtedly still housing children who are still being poisoned by lead. And the vicious cycle continues unless and until we end it. What are we prepared and willing to do to protect and ensure our future? So UPAL has some acts or some recommendations that I'll make at this time. For parents, you know your child better than anyone else. You are your child's first teacher, first doctor, first nurse. Advocate for your child. Ask questions until you get the answers that satisfy you. Don't be afraid to question those with degrees and titles, because their titles and degrees does not necessarily mean they know more than you. And our status as parents must also be respected. To our electeds and legislatures on the local, state, and national levels, be accountable to your constituents. Be transparent. Let us help you write the laws in ways that will truly benefit our communities. Pass laws that dismantle the systemic practices of exclusion and inequality. Show that you care about children by passing and upholding fair housing laws. Visit impacted communities and see the real lives and not just the numbers. To doctors, continue to test children for lead poisoning. Advocate for families living in zip codes that are high risk for lead poisoning. Screening and testing should be mandatory and offered by your office rather than parents having to repeatedly request that their child be tested. Health departments now like to say that lead levels are down, and of course they will be down if we are not testing. To educators, listen to teachers who work with children and see firsthand the struggles in the classroom. Don't expel and punish our children, setting them up for the school to prison pipeline. Don't fire teachers, as I was, who expose lead issues in our public schools. Instead, create a K-12 curriculum for lead-poisoned children so that they too can excel. To HUD and local and state housing authorities, clean up the toxic dwellings. Homes can be both safe and affordable. You know where the problems are, clean it up. Don't relegate families to live in houses you wouldn't move your own family into. Choose wellness. Damage done by lead persists a lifetime. If you had a choice, which glass would you drink from? Remember our families in Flint, Michigan, Washington, D.C., parts of New Jersey, and other communities around the country. Some did not have a choice because the elected officials lied to them. Stop telling us everything is all right when it's not. That old adage, an ounce of prevention is worth a pound of cure, is still true today. This is my handsome son, Zaki, who is now 26 years old, and he overcame the odds of lead poisoning. So those three that I mentioned earlier, medical, education, and housing. Zaki's last lead level was 3, which doctors say is about the average that we all are walking around with the lead level of 2 or 3. Educationally, Zaki graduated from high school, and studies show that lead poisoned children make up a large number of school dropouts. Housing, now Zaki now lives in his own lead-safe home with children of his own who we work daily to protect from lead. And I have written a book called A Child is a Terrible Thing to Waste that chronicles my family's experience with lead poisoning, because once my son was poisoned, we all were poisoned and we all went through it with him. And working now on the sequel to A Child's a Terrible Thing to Waste, which will be triumphing over lead. And that is my contact information. Contact UPAL. This is our website, our email, and our phone number. We are always available to speak with parents and to offer support. And I thank you all for your time this afternoon. Peace and blessings. And I'll turn it back over to Eric.
I guess that's me. Well, thank you, everyone. Thank you very much. Thank you to our audience. I think we have a few questions. We have at least one. This may be a question for our future sessions, but just offhand, if anyone has any recommendations for residential soil exposure around housing. Joseph is kind of thinking about kind of gardening in a yard or place like that. If there are any programs or local groups that are working with testing and mitigation in soil, would anyone have comment on that?
The only place that I've heard that had, well, that I was at, there may be others, but I know in Newport News, there was some housing that had contaminants in the ground in the housing project area, and they were removing those residents due to that. But I don't know if there is a program that actually would test lead in the soil, but lead can be present in the soil as well.
Mm-hmm.
Do you, Queen? Do you know of any?
Where is Mr. Phillips Johnson located? Which area of the state?
Yeah, if you could put that in the chat, Joseph, where you're located.
And I know the extension offices or some local gardening clubs, and I know EPA used to also test the soil. You can take a sample and send it.
Mm-hmm. We do have this other question. Well, Joseph is in Richmond. He's in Churchill.
In Churchill.
He's asking for others, he says.
Oh, okay.
And Donna Huang is also in the chat. She is part of Richmond's health district. She has some answers for you as well. She said that some environmental laboratories have soil testing kits. We do have a question from Diane. If anyone could comment on this, has COVID increased the number of child lead cases with children being home all day? I'm not sure if you might know that, Dr. Ross.
We don't know yet, just because we haven't been able to get as many kids into pediatric offices right now because of everything being so self-quarantined, that really a lot of the wellness visits overall have increased, and that's been a big campaign, is to get kids back in to see their doctors. So unfortunately, I don't think that the testing probably correlates yet with any exposures that might be happening.
Okay, thank you.
Hey everybody, just a quick reminder, if you have questions, please put them in the Q&A box and not the chat box. It's much easier for us to see them that way. Thank you.
Yes.
There are no safe levels. You're right, Lewis Bailey. There are no safe lead levels. And that's something that has bothered me as a parent and working with lead poisoned children. Over the years, we know it has dropped down from some 70 down to CDC having designated a level of 5 as a level of concern. But one of the things that bothers me is, and maybe Dr. Danny could answer this since he's with Richmond and Henrico, but a few of the localities here in Virginia have different lead levels of concern, like one may be 10, another may be 12 or 15. or 20. Can one of the doctors please address that? Why we all are not in line with CDC and their level of 5, even though 5 we know is not considered safe either.
Yeah, I would certainly echo everybody's comments that there is no safe level of lead exposure, and we should all espouse that. The state, and a lot of this does kind of depend on funding and capacity. So the state has a certain action level where, you know, a lead level of 10 or 15 may trigger a home visit and a comprehensive case management. So I think the long-term policy strategy is we've got to advocate for funding so that at the state and local levels, there's enough capacity to respond even at a 5 or above. Right now, we have a differential response where when you've got a lead level of 5, we'll send a mailer or make a call to a family, but we don't have the resources to go into the home and do environmental testing. Now, localities also have some ability to lower that lead level as well. And so you know, as you were mentioning, different localities have different action levels, and that can be done by local ordinance. But again, if they're not funding the response, then lowering the number doesn't actually help. We need to make sure we have enough funding to be able to go in, comprehensively case manage, identify the source of lead, and focus on prevention.
This other question here, does the state have or offer free home lead testing kits to parents, or at least available to the nurses going out to the home when conducting nursing assessment? Anyone have any comment on that? Either.
I feel like that's an answer I should know and don't. You know, when we have somebody who actually is lead poisoned, we go out to the home and do all of that environmental testing. I guess the question is, if you're just curious and you want to test the water or test the sample, like the actual testing requires some technical expertise. So the state doesn't provide that. You know, just keeping up the X-ray guns and doing the paint sampling and all of that requires some expertise. So that has to be done by a professional. And I think, as somebody was talking about earlier, there are soil and water tests. I don't know if there's funding available to do that in every community.
That again is a problem because our children are still being used as lead detectors. You know, there's generally no action until after the child has shown poison, that the child is lead poison. We must change that. Stop using our children to detect the poisoning, but be proactive and make sure that these homes are safe or whatever sources, and that our children are not becoming poisoned, and then we're reacting after the fact. You know, and it's always touted as being a lack of funding.
We have a question here from Marion. How can we find out if we have many lead contaminated homes in our zip code? Is that a possibility?
There's an existing zip code list of high risk zip codes. This could be found on the VDH website.
Thank you.
Hey, Eric, this is Hope. I just wanted to mention that CERCAP has a lead hazard reduction program for homes, and we can work anywhere in the state except for Richmond and Roanoke. So if people want to also reach out to us for the housing part, we can do that as well to help them indicate if lead is in the home, but don't forget the water as well.
Great, thank you. Yeah, and I think, you know, some of our questions that you might be having today could possibly be answered in our next session. That's where we're going to really talk about assessment, and we're going to talk about kind of the process, which can be very costly for certification and remediation. So definitely tune in, register for our next session. If there's any other questions, feel free to put them in the chat. Definitely. Yep.
If I may say something to Dr. Danny. Dr. Danny, how can we as citizens, especially because I'm a part of the Environmental Justice Coalition as well, how can we make it a push that children are tested at the lower levels instead of waiting until it gets higher? And to make it where they don't have lead present at all, if possible, because once you get it, there's nothing else you can do. It is pretty much with you for the rest of your life.
Yeah. Well, I think there's different levels of potential intervention, right? So there's the large scale political advocacy, which I would say talk to your local and state elected officials, talk to them about your concerns for lead poisoning in your community, and specifically the need to fund a response to a lower action level. And that requires funding through the state health department or other departments to be able to go in, do environmental testing, and do case management. Then there's also the prevention side of this, and HUD has offered grants for housing abatement, lead abatement. We had one of those, or have one of those here in Richmond, and it has been extremely challenging to get people to both allow us to come into the home to test for the presence of lead and then to actually do the lead abatement work. And so we've got to find more effective ways to work with families and to kind of have just that and part of the challenge in many of these cases is that the families who are exposed to that lead hazard aren't the owners of their homes, right? They're subject to the actions of landlords. And so I think this opens up another policy intervention around rental registries and a requirement that landlords do regular lead testing or are held to engage in abatement when a lead hazard is found. In Virginia, our legal and policy infrastructure around that has been fairly weak, and really, even if lead or if your home may have a lead hazard because it's old and built before 1978, all you have to really do is give that pamphlet to the renter who's coming in or to the person who's selling, and that's just not enough to really take responsibility of identifying lead hazard and doing something about it. So I think there's a lot that can happen in the policy arena, and that has to happen through the advocacy of people with their elected officials.
And I would say to enlist nonprofit organizations such as United Parents Against Lead. We too had a $2 million HUD grant to address residences, and we successfully implemented it in the city of Richmond and the city of Petersburg. So I don't know why the city of Richmond would be having that problem, but it could be because you all stick with the good old boy policies of just working with Project Home and overlooking organizations such as United Parents Against Lead. And that's on the state level, Chesterfield County, and all those that have funding that consistently do not, consistently exclude or United Parents Against Lead. And as I said, we have successfully implemented a $2 million HUD grant. So we got to stop getting this money and it not going to help the communities that we are writing for it to help. And after we spend the millions of dollars, the funds are left, the communities are left in the same condition or worse condition. And so, to keep saying we don't have the fund, it's no longer an acceptable excuse for me. Meanwhile, our children are still being poisoned.
We have another question here from Anita. What is done when a parent who has a lead child refused to let the health department in the home? I guess that goes back to Danny, your comment about getting into the home to testing and things like that, if that's correct. Could anyone kind of speak to that?
So let me see if I could read the question. The question is, if a parent is resistant to having the health department engage if their child has been identified with lead poisoning?
I believe that is the question being asked.
Boy, I don't know if Donna can chime in on the chat. I can't think of a situation where that's happened. I mean, my guess is that our next step would be to engage local DSS to support from a potential abuse and neglect standpoint, but we would want to lean our partner agencies to help with that. But that is such a rare occurrence. I can't think of any situation in the last decade that I've been here where we've had a family that was resistant to us working with a child. I mean, most parents are very concerned when they get that best result.
And I think the root of that will be because some parents fear eviction, which is why we're having this webinar. We have to make sure that, tenants are protected. We have tenants' rights in place so that they don't have to worry about being evicted because they report a problem with the housing, such as a child being poisoned by lead. And we can't be further punitive to the family by calling in DSS and saying that it's a case of neglect because they are fearing being, becoming homeless.
That's a great point. All right, I think we're kind of ending our session here. Just kind of like to thank all of our panelists here just for your time and your investment in health and housing and the importance of both. And for our audience, I'd like to remind you again, please sign up and register for our following sessions. We have 3 more sessions that are going to be occurring same time, same day for the next 3 weeks. So Wednesdays starting at 2. So we have some other great panelists coming in to talk about how we can kind of address this issue here in Virginia, within low-income communities and for renter communities as well. So with that, just like to thank everyone. Thank you, Danny. Thank you, Jenny. Thank you, Hope. Thank you, Queen.
Thank you.
And I hope everyone has a great day.
Thank you.
Thanks all.
Great discussion.
Thank you.
Dr. Danny, I'm gonna give you a call.
Sounds good, Hope. Yeah.